My name's Steve Jenzik. I'm a family physician here at York Hospital. I've been in private practice for the last 20 years at York Family Practice, and in November of 2009, I joined the hospital staff as the administrator or physician in charge of the physician-owned practices here at York. I grew up in Rhode Island, small state, a couple states away from here, and was looking to return to the New England area as a family physician as I ended my military career. I happened to vacation in Maine when I was a child and happened to be stationed at Pease Air Force Base in New Hampshire just across the river and was renting a home in York. My family fell in love with York and neighbors suggested that I look into opportunities here. There was something really special about York Hospital when I met Judd Knox, who was the president of the hospital then and is the current president today. There seemed to be a real air of cooperation amongst the staff. I'd walk down the hallway with Judd on my tour, and Judd knew the janitor, he knew the charge nurse, just like they were his everyday friends. And I thought that was quite special, and I felt that when I saw the staff talking and seeing other physicians as well. And so it was a great community to live in, and it looked like it was be a great community to practice in. And so I took a chance and started a solo practice. My family at the time we moved here were two girls, 4 and 2. They went through the school system here in York. The educational opportunities from the high school here are just as great as any private school you can find in northern New England. There's a lot of cultural activities available here. I found a gem of a little city called Portsmouth, New Hampshire, which is 15 minutes away. That has pretty much most things that you'd want to see in Boston except the big shows. Portland, Maine is 50 minutes away. And offers a lot of those recreational opportunities as well. The other neat thing about being here in York is that we're an hour and 15 minutes from some of the best medical centers in the world, which are in the Boston area. Maine Medical Center to the north also offers a lot of opportunities for tertiary care. So here I had the best of both worlds, a great small facility to practice in where I really knew my patients and fellow caregivers, and I had the opportunities to work with some of the best minds in medicine within an hour and a half drive either way. A concern some physicians will also have is, well, what does my spouse do? Where does he or she work? Well, we're within the Boston metropolitan market really as far as job placements go. It's an hour and 15 minutes to downtown Boston. You can take the train down from one of the surrounding towns, Wells or Dover, or there's a bus service from Portsmouth that goes directly to downtown Boston. The greater 128 technology area also is a large employer for patients in this area. It's actually easier to commute to downtown Boston from here than it is from the west side of Boston. York is a pretty interesting place. It was the first hospital really between Boston and Portland, small community hospital that had interventional cardiology capabilities where we had a cath lab that got started. Larry Petrovich came here in the late 70s. He trained down in Houston with DeBakey and his colleagues there and brought interventional cardiology. We can do interventional, we can place stents, we can do ICD or defibrillator implants, we can do electrocardiology or electrophysiological studies here. If somebody needs open heart, we have an arrangement with Portsmouth Hospital 15 minutes away that we can get patients there before the OR team can even be assembled to have open heart surgery done. More recently, we've had a stellar oncology program. We have 4 full-time oncologists now that work in cooperation with Beth Israel on some trials. They're members of the ECOG oncology study group as well. So we have trials that are available to us here at a small hospital that you usually only found before at larger centers. The breast diagnostic program that we have here in the imaging program is very unique. Large hospitals don't even do that. The nearest center that accomplishes what we were doing was the Faulkner Breast Center, which is pretty well known throughout New England. So the ability for a woman to have her mammogram read and walk out with the results without worries about what it may show or waiting 2 or 3 days is phenomenal. One of the technologies that's available to treat prostatic hyperplasia or BPH is the green light laser. We're able to offer that to patients here. Prior to that, that was only available in larger centers. York Hospital is a special place. It has a very strong emphasis on the patient experience, the patient care. Everything is done to make the patient comfortable throughout the care process, whether it be their visit in the office or their stay in the hospital. The hospital is really in tune with what the patient's needs and desires are. They survey the patients. They have working teams with patients to look at areas that we could help improve upon, whether it be the noise level in the hospital or the quality of the mattress or the pillow. It really does show a focus. Judd Knox, our CEO, is extremely interested in making sure those patients are comfortable. As we speak, York Hospital is in the midst of opening a brand new surgical center. We've gone from 3 operating suites to 5 operating suites. The technology that's available here in the new operating rooms will rival any operating room anywhere else in the country. We really have weaved ourselves into the community so that all the surrounding communities have satellites of York Hospital available so they can get their blood work, their x-rays, and have access to the specialists there as well as their primary physicians. So if you're a physician, you have a tremendous number of opportunities to choose from. You owe it to yourself to look at those opportunities and see what's out there. But do yourself a favor. Look at York. York is a wonderful place to live. It has a great medical staff. There are lots of opportunities to practice here and be fulfilled. I came here 22 years ago. I've never regretted it. It's a wonderful place to be, both as a physician and for my family. I'd never trade it for anything else in the world. Making unbelievable experiences happen every day. That's how we do it at York Hospital.